Hello and welcome back to the Care Certificate. This is Standard 9, and in this module we're looking at an array of conditions. So we're looking at mental health, dementia, which is under the mental health category, and then learning disabilities. So let's start off. Awareness of mental health, dementia and learning disabilities is fundamental to what we do in health and social care. We know that the people we come across and some of our customers in domiciliary and home care will have an array of conditions. We also have a learning disability service, so again, there may be people with more than one condition and one diagnosis. So it's important we have some basic awareness training. This standard aims to make you aware of the people's experiences and what causes mental health conditions, dementia and learning disabilities. While you may not be working in a role directly supporting people with ill health or dementia or learning disabilities, it's still important for you to be aware of the conditions. So as we go through this, we'll try and make it relevant to the roles and give you some real insight to some of the conditions. So let's look at mental health conditions. So we know that we all suffer with mental health. You can't have health without mental health, and that was one of the strategies a few years ago from the Department of Health. We're aware that 1 in 4 of us may experience a mental health condition throughout our lives. Therefore, it's so important we have a much better understanding around mental health and reduce some of the stigma and poor language that's associated around it. Mental health can be seen positively to identify a positive state of mental well-being, or negatively to identify a state of mental well-being, for example, experiencing mental health problems. This can cause distress and reducing functioning. Some people may suffer with a condition called depression. Depression is a condition in which we have low feelings of mood and we're unable to feel fulfillment in life, so there's no enjoyment in whatever we do. There are 2 types of depression as we go through. We can have our everyday depression or bipolar, which is a form of depression. So we have extreme highs and extreme lows. What we have to experience, or what we have to come to terms with depression, is feelings and emotions in normal everyday situations. So for example, if we've lost a loved one or we've had some bad news, it would be normal for us to feel tearful and low in mood. However, through a period of time, we should get over this and recover back to our normal selves. If the low mood lasts more than a couple of weeks, then we start to move into the realms of having a condition. And there are things that we can do to help people with depression. There are organisations in which you can go and you can look online to have a look at. Depression comes when we have a lack of serotonin in our brain. So it's the chemical, the happy chemical, that helps us function. When we think about what makes us well, we think about maybe being outside in the sunlight. Sunlight contains vitamin D, and actually we need that within our bodies. If we don't eat well, we feel sluggish and low, so therefore eating foods that are rich in vitamins and minerals can boost our serotonin levels. We feel happy when we exercise and we move. Again, it releases chemicals in the brain, which puts our mood up and picks our mood up. So there's lots of things we can do to support somebody with depression. Anxiety. Anxiety is a feeling of extreme worry, some pending doom, some constant fear. And if you've never experienced anxiety, maybe think of a phobia that you have. Maybe you don't like flying or spiders, and it's living with that fear all the time. You have physical signs with anxiety. It can increase your breathing, it can make you breathe faster. Meaning if we're taking in more oxygen, we're taking in less carbon dioxide. So therefore it's important that we try to help regulate breathing. We may find that our heart rate increases, so our heart's pumping faster. So we could help somebody by calming them down. Psychological, we can see things of feeling losing control and people saying that they want to run away and they can't cope. So we need to try and help those thoughts by slowing the mind down. We can do that by breathing exercises. So asking people to just stand up, breathe in for 7 seconds, hold, breathe out for 11 seconds can help regulate the breathing and calm the mind down. Maybe we could try some distraction techniques, take them out to look at the window or something. If the phobia or the thing that's causing the anxiety is close by, maybe we can move that out of the way, giving them an opportunity to recover. You may have things around their cognitive process, such as their thoughts and the way that they process things changing. Maybe they say to you their mind's just racing. So it's about trying to slow those thoughts down and give them an opportunity to think. You may find behaviourally that they change. They stop going out, they stop doing things, they might self-isolate, they may start using drugs or alcohol or self-medicating to help improve their condition. So again, we can look at things in which we can do to help alleviate those symptoms. So anxiety, again, we can use other methods to help people with anxiety. So psychological symptoms are related to feelings and emotions, and cognitive refers to the brain and the way that we think. So dementia would be seen as a cognitive process. There are ways in which we can help people. So there's CBT, cognitive behaviour therapy, which looks at thoughts, feelings and behaviours. CBT makes us stop to think about our thoughts, makes us think about our feelings, and really makes us explore our behaviour while we're doing things. You may find that you're unable to help somebody because of lack of knowledge or understanding. However, what you could do is refer them to self-help guides or self-help apps on your smartphones. So there's lots of ways in which you can help somebody, even if you feel powerless. Psychosis is a condition in which creates an altered perception to somebody's reality or world. So in other words, they may be hearing voices, they may be seeing things. It may cause extreme behaviours, such as the bipolar as listed here. The NHS suggests that 3 out of every 100 people will suffer with extreme conditions such as schizophrenia or bipolar. Schizophrenia looks at a breakdown of reality, therefore they may start to hallucinate and see things or hear things. Now it's important that we have a real understanding around schizophrenia and we don't start labelling people, because that wouldn't be helpful. But let's just explore our own thoughts for a minute. All of us have an internal voice. It's our little Jiminy Cricket telling us right and wrong, should we do something, should we not do it. And an internal voice is absolutely fine, as long as it's not a harmful one. It's if they're hearing voices externally, so like I'm talking to you via this training session, can they hear in that way? Visually, we have our mind's eye. Sometimes we picture something like a holiday or a scene and we can place that in our mind. Again, that's fine. What would be more concerning is if they're seeing and responding to things that we can't see or respond to. So that would show signs that someone's in a crisis. Bipolar, again, is an extreme form of depression. So you've got low moods and high moods, and again, people could swing from being very low mood, not having any feelings, to being elated. And that puts people at risk, because when we're elated and we don't care, we can be frivolous, we take unnecessary risks, and we can put ourselves in quite sort of harm. So it's important we realise that. So lots of things, again, in which we can do there. So keeping people safe, trying to help them to understand their thoughts and feelings, not arguing with them, and trying to get them the help that they need. A lot of the symptoms and signs and symptoms around this are things that you can help people with. So again, as we said in previous trainings, we can't cure this, that's not our role to cure it, but we can alleviate the signs and the symptoms. So if somebody's distressed and they're upset and they're crying, we can show some kindness and compassion to manage the symptoms in which we're seeing. People experience different results for different reasons. Maybe they've had a traumatic event, so such as PTSD, or an accident, or maybe a death, and it's bringing flashbacks to things. There may be a chemical imbalance in the brain. So again, if we were talking about that serotonin, maybe they're not producing enough dopamine or serotonin to keep in balance. Mental health problems are on a significant rise, and we need to make sure that we're fully aware of those conditions. What's unhelpful language is saying things such as they're putting it on, they're making it up, they're acting crazy, they should be locked up, we should put them in an asylum. All of that's negative. It won't promote recovery and it won't help people feel any better. And actually it comes across very judgmental. It's useful for you to educate yourself and to go further reading. So again, we have different websites here in which you can go to help find additional information. So we have Mind, We Think, and the Mental Health Organisation. Your company will have policies and procedures in place, and again, people with mental health conditions will have a care plan wrapped around that health condition. So it's important that we follow those. Now let's move over to dementia. So dementia is a cognitive impairment, and we know it's on the rise because we're an ageing population. However, dementia does not associate with just the ageing population. So one of the youngest people diagnosed is 23 years old, so we know it's not around that. We know what dementia is and does, so it affects our memory, our thinking, our reasoning and our communicating skills. I want us to think for just one moment, whilst we have all of these, it will affect everybody in a different way. So imagine your brain as a glass bowl, and in that glass bowl we're going to fill it with Christmas fairy lights. Each fairy light is a memory or an emotion or a trigger or a sense. And what dementia is, those light bulbs are turned out in different ways. So my memory may be staggered, so I don't use my whole memory, I may just use parts of my memory. My communication, I may just not be able to pronounce a particular letter or a particular vowel, but I can still communicate. My thinking and reasoning will be deteriorated, but again, in different ways. So no one dementia is alike. So it's important to understand how dementia works. People will feel confused, they're going to feel frustrated and they're going to be frightened. It's down to us to support people, to help them become aware of their surroundings and what's going on. Again, we need to be careful with the language that we're using with dementia. So we don't want to say people are surviving and it's got all these horrible negative terms. We want to make sure that people can thrive and still live well with the diagnosis of dementia. And it's important we change those negative experiences into more positive ones. Here we're looking at two common types of dementia. So we've got Alzheimer's, which is an umbrella term for lots of different types of dementia, and then we've got vascular dementia. So that's where we're looking at lack of oxygen to the brain. All of these will affect people in different ways. If we have the dementia that affects the frontal lobe, then we know that people become slightly more emotional and challenging. So it's important we understand the type of dementia so we can wrap the type of treatment around them. When we're supporting with people with dementia, it's not just the person with dementia that needs the support and encouragement, it's also family members. Family members can feel confused, they can feel angry, in which they're watching a loved one deteriorate over time. And it's important for us to empower them and give them hope and some kind of sense and purpose to why they need to remain in the care and be part of the care package. Now, we know dementia affects our short-term memory, and what tends to happen is people forget who we are. What you then see is as the dementia takes hold, people will look at other people and maybe they'll look at their children, think that they're their husband, and that's because their memories are going back to a time when they were younger. So we need to enter their world, we need to see why people are doing what they're doing. And a couple of examples of those could be, if I'm living with dementia and I'm taking my medication and I may be seeing hallucinations, so I'm grabbing out seeing spots, maybe that's because of the medication. If you see me walking and I look a bit unsteady, maybe because I feel the floor is slightly raised and it's not. If we look at the floor and it's shiny, maybe I think it's water. If there's a mat in front of the door, maybe I think it's a hole. So if you enter my world, you may have an understanding of why I'm getting frustrated or scared. Equally, just because I'm frustrated and scared doesn't mean that I lose my emotions. So I've forgotten my memories, but my emotions still stay. And let me explain how that works. Imagine you have a bookcase, and as we go through our bookcase, we start at the lower end of the bookcase, and they're all my childhood memories. My middle bookcase looks at my midlife and my marriages maybe and the children that I have. And my older books in my bookcase are coming now into retirement and my current health conditions. With my dementia, books fall out and they're my memories. But which books fall out first on this bookcase? It'll be the ones at the top. So therefore, when the dementia stops rocking, you need to find where I've settled down at. And that's where I will feel that I'm at, because that's where my memories have taken me to. So yes, I may have forgotten who you are. But now think of another bookcase, but made of much stronger wood. And this is my emotional bookcase. And this one, when it rocks, the books don't drop. And that's because I may remember the love and the feelings. So let's put this into some context so you understand. It's important that people understand this so you can tell this to family members. So imagine I take my nan out. We go in a car, we go to the beach, we have an ice cream, and it's a lovely day. It's warm and it's sunny. My nan's feeling will be, what a lovely day, and I feel loved and secure. I get in the car and I ask my nan, did you have a nice day? And she's forgotten already. So the memory's gone. But what she's left with is the emotion, the feeling of happy and safe. So surely that means quite a lot. That means that what we're doing, we're still leaving that person with some kind of care and compassion. And I think if we can think about things like that, it'll help you manage people, and when people ask you about dementia, it'll give you some story and insight in which you can discuss that with. Now, those analogies come from an organisation for the Alzheimer's Society, and they have a process called Dementia Friends, and that's where you can sign up to become a dementia friend and help reduce the stigma and raise the awareness. And I highly recommend you all go online and have a look at that, because those stories and videos there, which are done much better than I've done, really give you the feel and a great way of explaining dementia to people. Now, let's move down to learning disabilities. So, a learning disability, or an intellectual difficulty as other people are now calling it, results from brain development being affected before birth or during or after birth. So it may be postnatal or prenatal. So it may be a lack of oxygen, it could be a lack of oxygen through delivery, or maybe some kind of trauma afterwards. Just because somebody has learning difficulties does not mean they're unable to learn. It's a complete misunderstanding. You just have to find the way in which people learn. Now for us, we all learn in a different way. Some of us will learn through seeing, some of us will learn through reading, and some of us will learn through doing something. And when we're working with people with learning disabilities, maybe they need a combination of everything. And it's that constant repeat. It's important that we meet sensory needs. So a lot of people with learning difficulties will have sensory rooms, so they like to touch, feel, smell, and they use all the senses to help reinforce positive messages. It's important that when we're working with people with particular needs, that we understand what those needs are and we work in a person-centred way. But we communicate with people showing respect, due care and compassion. We don't need to talk down to people. We talk to them as if we are holding a normal conversation. We may limit what we're saying and we may not use such complicated words, but again, we'll talk in a way which shows respect. Other conditions may be such as Down syndrome, and this is due to extra chromosomes and has a cognitive impairment and has things around physical growth and is a moderate developmental disability. It can happen with complications of birth, which leads to lack of oxygen and impedes the development, or illness and injury to the brain, such as meningitis or maybe a stroke. So there's lots of things there. The reality is we're going to deal with people in the same way that we would in any other situation. We use our 6 C's, we're going to communicate, and we're going to work in a person-centred way. People with learning disabilities also can experience physical health conditions and mental health conditions. And because we're now entering an aging society, we're seeing a new phenomenon for people with learning disabilities having diagnosis of dementia. So it's important we know how to work with those, and again, we should be working in a person-centred way and having care plans written. It's important that we have self-awareness and we're able to look at our own feelings and thoughts and emotions around these subjects, so around mental health and learning disabilities and dementia. Care and support needs to be given. We need to understand people's life histories. We need to understand their needs, wishes and wants, and to accept that they're going to have the same needs as we do. So when we think about that, that's going to be needs around food, warmth, affection, socialisation, and maintaining or forming new relationships. It's all about promoting positive attitudes, seeing somebody beyond the diagnosis or the condition that they have, allowing them the best opportunity to live a fulfilled life, and to have the same rights that you have. And that's a fundamental importance when working with people with different needs. We need to work across our society and change the way that people see disabilities, and to try and reduce the stigma, and to raise a positive awareness and to work alongside people. Again, we need to look at some of the barriers that people face. And some of the barriers that people face with mental health or learning disabilities will be accessing services, forming relationships, the right to vote, all things like this, which we take for granted in our everyday lives. So it's important that we can work with people to raise those awarenesses. It's important that we raise the barriers to reduce stereotypes, and we work in a more centred way. We need to ensure that accessibility is there, that we can actually get everyone into our community in experiencing all parts of it. It's important we reduce and stop stereotyping. For example, people with mental health aren't crazy, and people with learning disabilities are not unable to learn. The law says under the Equality Act that we need to make reasonable adaptations and adjustments. And again, it is what's reasonable. So if we're accessing services and maybe we're taking them to the coffee shop, it's not unreasonable to have handrails or adaptations of equipment in areas for people to be able to thrive and live more independently. Moving on, we've got to raise concerns. So again, using our safeguarding and whistleblowing procedures, really advocating and supporting this equality and this inclusion to society. We should identify key ways of working. There's a wonderful organisation for Dignity Champions, which is a website you can go to, and they have 10 core principles about dignity. But it's about being compassionate in practice, making sure that we're doing everything we can to promote people's rights. We need to work in a way which is non-ambiguous. We need to be clear. We need to be accurate in what we're saying. And again, we need to ensure that we're applying the same principles of choice, capacity, and rights around data protection and GDPR. It's important that we get early diagnoses in some conditions, especially for mental health and for dementia, because the sooner we have the right diagnosis, the sooner we can start looking at nursing interventions and care interventions that help meet people's needs. We may need to raise awareness with families and friends and again provide psychoeducation to support people to understand. We may need to find out other treatment options and maybe some information. It might be helpful to find advocate groups in the area and understand what's in your community to help raise the awareness. And it's about finding the right resources and support to make sure that people in our community can strive and thrive and have the same rights that you have. So where can we go? There's lots of things in which we can do to find other areas of information. Again, finding the right community support groups, finding the right resources. I'm aware we are in a time where resources are limited, but we have such wonderful things in which we can communicate. If we go back to our first unit around communication, we can adapt the way that we speak. Maybe we can write, maybe we can use technology, maybe we can use Makaton, which is a form of sign language. It's important that we find the adaptations that meet those individual needs and complex needs. We're aware that there's the legal framework around all of this, so we have a whole set of legislation in law protecting people with mental health and learning disabilities and dementia, and your company should have a series of policies and guidelines for you to read. Again, same laws and legislations we've seen throughout the other modules, such as human rights, the Care Act, GDPR, safeguarding, and the fundamental care standards. We also have legislation now around mental health. So we have the Mental Health Act, the Mental Capacity Act, and we start to now look at what capacity is. So everybody is assumed to have capacity unless otherwise stated. What that means is I must offer choice and respect in the same way that I would everybody else if you are not deemed to have capacity or no capacity. If you're deemed not to have capacity, I will still ask you and give you rights and choices, but I may change the way in which I do that or offer you different outcomes which best meet your needs. We have to assume everybody has capacity. Just because somebody makes an unwise choice does not mean that they lack capacity. To have capacity, you need to follow the capacity principles. In a nutshell, what that means is, if I ask you something or tell you something, you must be able to weigh it up and make a decision. If you're able to weigh it up and make a decision, then you're deemed to have capacity. If you're unable to weigh things up and make a decision, then you are normally somebody who lacks the ability to make a decision. Again, you'll know this because in care plans it will say whether or not you have advocates, that somebody's working on there for them, but they're able to make choices for themselves, or that we do what's called is working in the best interest. Again, you will have further training on consent and mental capacity. So the capacity assessment looks at, does the person have impaired or disturbed functioning? So do they already have something there, maybe dementia or something else? This can be associated with mental illness and sometimes can be a result of drugs or substance misuse. And we know that overuse of drugs or substances can cause a form of dementia, called cortical dementia. 2, does the impairment or disturbance mean that even when given appropriate support, the person is unable to make a decision? So, for example, if we're talking about buying a house, do you understand all the processes involved? Because it's quite a complex task. However, I may say to you, do you want a hot drink, tea or coffee? So you may be able to understand this, but not this. So it's important that they understand it, they need to retain the information, they need to weigh it up, and they need to be able to communicate. So they're the 4 principles. Down here, we then have the 5 principles for assessing somebody's capacity. So 1, always assume the person can make their own decision. 2, ensure all possible support is provided to make sure that the person can make their own decision. 3, we do not assume someone cannot make their decision just because they feel that they're making an unwise or unsafe. 4, if it has been identified that the person cannot make a decision, someone can make a decision that is deemed to be in the person's best interest. And 5, if a person makes a decision on behalf of an individual, this must be the least restrictive option. What that means there is, say for example, you've got little Mary, she's got dementia, and Mary's terrified of having a bath. The least restrictive option for Mary's personal hygiene would be giving her a flannel and washing. So the mental capacity is part of the Mental Capacity Act. The nursing team and psychology teams will do the assessments and they'll obviously let you know. But what's important is capacity is fluid and it changes on a regular basis. So it's important that we're aware of that. And again, for us to have consent, we need to be aware that, again, that also changes continually. Finally, coming down to consent, children up to the age of 16 are then able to consent to their own treatment, and this can only be overruled in certain circumstances. Like adults and young people, they're due to have significant capacity. So there is a thing called the Gilligan test, and the Gilligan test is all about trying to show that the person is able to make decisions, etc. But you won't normally have to worry about those. So let's now look at what you need to do to pass this standard. So the first task here is you need to list someone that may have the following conditions and include the ways in which you can help them and that are affected. So we look at anxiety, depression, psychosis, dementia and learning disabilities. So again here you're going to then explain how the conditions may influence the person's individual care needs. Here we're going to talk about different ways of supporting people with mental health conditions, dementia or learning disabilities. So why is it important to understand the cause and people's support needs that are different? So there we're trying to look at if someone's got dementia, why would we be helping in a certain way? Here we're going to look at attitude, and you need to give one example around negative attitude and the impact it may have, and then give examples of how positive changes will have as well. So we look at negative and positive. Here you're going to describe again what is meant by social mobile for disabilities, look at support, positive attitudes for workers and personal centred practices. So again, it's asking you just to complete those sentences to think about those. Here we've got a box, so it's giving you the condition here, the actions in which you could take, but it wants you to then think about what is it and why would it be useful. So psychosis, if we think in additional training for workers, well, how would that be useful? Why would what training would I have? Why would that training then be useful? Here, in your own organisation, including procedures, describe how to report concerns associated with unmet needs and mental health conditions. So, for example, you may have an elderly lady or an elderly gentleman with dementia who's got an unmet need, so maybe their personal hygiene is not being met because they're constantly refusing, or maybe you can see they're incontinent and they're refusing to care, and how would you help them to meet that need? Here it wants you to explain to live and write a list, and as we go round, it's the benefits of early detection. So again, think about mental health, dementia, learning disability, and think about some of the things which would benefit. Here we're looking at how you can support people and what the adjustments are. So again, we're thinking about reasonable adjustments. So here we've got anxiety. How could you help them and why? And we just fill in those boxes as we go down. This one again, we've got, it's all based on legislation. So you've got the law here, we've got why we've got this law. So again, you're summarising the law here. And here, what's the benefit of it? How does it help that person? So how does the Human Rights Act benefit somebody with dementia? And it'll be useful just to hold kind of an illness in your mind or a condition in your mind to complete those tasks. This one, in your own words, explain what is meant by the terms capacity. So think about the right to choose, think about consent and understanding. In this one, you're going to explain why it's important to assume that somebody has capacity. So we go back to what I originally said. Everyone is assumed to have capacity unless otherwise stated. and further up we looked at some of the things that are associated with that. Okay, and finally a few more here. What is meant by the terms of consent, so we're going to fill that in, and what is informed consent. Here you're looking at two examples on how consent may change depending on decisions that are being made. So again, just think an example. So an assessment capacity may be carried out when it's asking you to describe something. So it may be a change of needs or circumstances, maybe a review's due, maybe the fact somebody's had an accident, or maybe they've had a temporary illness, or perhaps they've got a urine infection, and that's going to change our capacity. Advanced statements, again, if you've done our end-of-life care plan, you'll be aware of advanced statements. So these are the plans about the choices we make, and it's asking you to think about advanced statements and why they're important to future care and because. So I appreciate that there's quite a lot in that section for mental health, learning disability and dementia. You will do dementia again as a separate module moving forward, and we do the mental health first aider at work class. If you need further information, advice and guidance, I can highly recommend Dementia Friends to find more information for dementia and the Alzheimer's Society. And Rethink and Mind are great for mental health conditions. For learning disabilities, again, it's useful to go online, have a look. There's lots of societies to support people with learning disabilities, around complex learning disabilities from mild to moderate. So it's worthwhile. There are over nearly 300 conditions for mental health, so we don't expect you to know them all. You will need to become familiar with just the top ones and just understand about how you're talking and acting and presenting around people with mental health. Thank you for watching. If you need any further help, let me know, or your supervisors know, and you should receive feedback shortly from your tutor. So I will see you in section 10.